Um, Hello, welcome to our Chicago Healthcare Tableau User Group, Q1 2022. It's been quite a while since our last user group. We like to do these quarterly, but I think it's been since this quarter last year that we've met. Sorry about the long delay. We've had just life and work and busyness of the leadership team going on. But we have some great presentations lined up for you today, which I'm very excited about. But first, I'll start with introductions of the leadership team. I'm Kelly Sims for you. For those of you who don't know, I know Heather is usually our MC of the group, but she is very busy and might be popping in later today to say hi. I'm a senior health informatics analyst at Lake County Health Department. And so I work with the nitty-gritty of Tableau each and every day. And I've been with the leadership group about 2.5 years now. And then I'll pass it over to Imran, another leadership member, to introduce himself.
Welcome everyone to this group. My name is Imran. I work with the Rush University Medical Center as a senior data warehouse analyst. And yep, welcome everyone. Happy to have you here. I will pass it to our new member, Chandni Pandya, who is joining our leadership group.
Hi everyone, I'm Chandni. I am also a senior data analyst with Illinois Hospital Association. Glad to be joining this group and excited for the future events and meetings.
Yeah, thank you, Chandni. We're lucky to have you and very excited. And then let's get started with our first presentation from Jeff Balsewicz from the Illinois Health and Hospital Association. He has an interesting presentation for us today about how IHA is using their Tableau enterprise server as a self-service analytics platform to help hospitals analyze their hospital-wide readmissions rates in their communities. Jeff is the Director of Operations. Oh, there we go. You're sharing your screen. At IHA, and he has his master's in public health from Johns Hopkins. Welcome, Jeff.
Great. Thanks so much for having me, everyone. I'm happy to be able to share with you some dashboards that we have created here at IHA. I will commonly refer to it as that because we have to take a breath whenever we say our full company name. So from here on forth, you'll just hear IHA going forward. So as we get started here, I just wanted to give you some background on who we are, what we do, where we get our data from, and that'll serve hopefully as a good foundation. So when we switch over to the dashboards, that you'll kind of get a sense of how we have all this complex data. So let's get started. Mission and vision, I won't read it off to you, but really our goal here is to be a trusted voice, trusted resource, and trusted partner for our member hospitals as they serve their patients. There's over 200 hospitals within the state, which means that they each have 200 things probably that they want to focus on. So we act kind of as that singular voice to say, as new policy comes out, as the healthcare landscape changes, that we really want to be that voice to say, this is what's happening, this is where we need to go. And then we can help make sure that all of our hospitals get the best outcomes for them. So if you want to learn more, our websites are down here, so feel free to check us out. All right, so like I said, there are 200 hospitals throughout the state. This is the Chicago Healthcare Tableau User Group, but we also serve hospitals that are far south, far west. If you look at our state, actually most of it is rural, meaning that the hospitals in the southern part of the state are normally smaller, they're critical access, and they might not have the same staffing as those in Chicago, where, you know, if I walk down the street for a few miles, I can probably run into 1 or 2 different hospitals where they have teams of Tableau dashboarders, you know, that can create things for us. So we're serving a diverse group of hospitals, which means that we have a diverse user base. The system that we create is a self-service platform, meaning each hospital gets to log into it, and then they get to use our dashboards as a template to then say, if they want to look at certain service lines or certain geographies or certain types of patients, they can pick and choose what they want to do. This is helpful for us because that means that we don't have to create 200 different dashboards for each hospital, but really it's giving them the flexibility then to be able to pick and choose how they want to create their dashboards and their analytics. So how do we use Tableau? We use it as a enterprise server. Where we get our data from is actually directly from the hospitals themselves. So the hospitals send their data to us. There's a state law where all hospitals must send in their inpatient data and a majority of their outpatient data to the state. We act as the data collection agent for the state, and we actually compile that data for them. And then on a quarterly basis, we take that data and we publish it up to our server, and then we let the different hospitals log into it, and then they can pick and choose what they want to look at. So we have a lot of different uses. When you look at patient data or think about it, there's things like, you know, who is the patient? We aren't showing names or things like that, but we're looking at their age, their race, their gender, what zip code or county they come from. We're also looking at things like the services. So which diagnosis codes do those patients have? What procedure codes are on that record? So there's a lot of data that we can drill down into, which means it's a pretty vast data set. So the key uses for our comp data platform is market share, service lines, but we also look at things like what are the chronic codes on a patient? So do they have diabetes, asthma? We obviously have COVID dashboards just like everyone else does. But what I want to share with you guys this afternoon is how we use our inpatient data to look at readmissions to the hospital. So just to give you a size of how much data we have behind the scenes, we get just over 4 million patient records per quarter. In our dashboards, we keep a rolling 12 quarters, which means we're at, you know, every single time that we refresh data, we're looking at maybe 50 million patient records behind the scenes driving our dashboard. So it's what I think is a pretty decently sized data set. So in terms of readmissions, we're looking at inpatient hospital data. So we're getting that from all of our hospitals. Because we do have patient information, we are able to look behind the scenes and start to link those patients between different hospitals. So if I, Jeff, go to a hospital and then I go to hospital B, we can start to map out and see that I'm going to multiple places and what dates those are. In terms of readmissions, we're using the CMS all-cause methodology. We did have one slight tweak to that in which we're not just looking at CMS beneficiary patients, we're actually looking at all adult patients. So you're able to look at readmissions for private insurance payers and pretty much any service line as well. So if I can quickly boil down readmissions into like a 30-second snapshot, just in case you don't use this data currently, it's looking at the potential for 2 visits from a patient. So CMS looks at it and says the moment a patient leaves a hospital as an inpatient, they have 30 days. If that patient doesn't come back to the hospital, that is what we would like to say is a good outcome. So we're keeping the patient out of the hospital, hopefully they're well, but they don't need to return to be hospitalized. So that patient's in our data set, but we like what we see there because that patient's not coming back. However, if that patient does come back to the hospital as an inpatient, we then classify that as a readmission. And what our goal is at the hospitals is to make sure that we keep readmissions down. Because for whatever reason they're coming back, if it's they didn't pick up their medication, or they didn't go see their primary care, or they just had bad luck and had to go back to the hospital. Hospitals want to keep their patients well. They don't want them coming back. And a secondary thing is that hospitals that have higher readmission rates will eventually get their reimbursements docked by CMS. So even if you don't care about the patient perspective, financially, if your hospital's not getting the reimbursements that they thought they were, that's going to hurt future services. All right, so let's transfer over now that we have a little foundation on what readmissions is and where we get our data. We can start to show you guys how Tableau works for our data set. And if anyone has questions, feel free to type them in the chat, and I will definitely make sure to try to stop through this and give you some answers. All right, so with our readmissions dashboards, we have 4 of them on our server that our member hospitals can log into to view. Each one tells a different part of the story. So I'm not sure about everyone else here, but when I started with Tableau, my first goal was to pack everything into one dashboard and try to say, this one singular dashboard will do everything for every single hospital. That doesn't work. So we like to try to break it out and say each dashboard has a very focused reason. And then as we combine them, that can help tell the overall story, because there is just so much data behind the scenes that we want to group it by or analyze. So I'm going to start with the readmissions demographics dashboard and use this one kind of as my primary base. For anyone currently that has comp data, you're going to notice that this is slightly different from what you possibly see. We are making some updates, so you can kind of see a sneak peek here. All right, so with our dashboards, we use the tabbed view version. So what that lets hospitals do is kind of click between different dashboards to tell their story without having to move around or exit out of a workbook. This also will let our filters carry over, so that if you're looking at something here within this dashboard and then you want to bring that idea or those filters over to the next one, you can do that. So right below our tabbed views, we have 2 icons. The first one is a filter icon. This is using the show hide feature in Tableau. So when you click on that filter, it's now going to pop up a filter box window. So any user that uses this dashboard can go in here and set up the filters that they need to for their hospital. So I pre-created one for you, but it's using the Chicago zip codes, meaning if the patient resides in Chicago, we're going to be pulling those patient records. But they can do other things like look at age groups or the race of the patient. We have service lines. We're going to be grouping filters by different categories in these columns to help show users what they can use in case they haven't used readmissions data much. The second icon that we have is a hyperlink to a resources page. Readmissions is such a complicated thing that sometimes you might need to have a refresher on what exactly am I looking at, or how do we quantify something. So this brings them to some links that we have out there. So we found that can be helpful just in case anyone has questions. Right below that, then we have some different KPIs or big numbers. So we can kind of walk across those. This first one is the number of at-risk visits. Think of that as the number of patients that are hospitalized. The next is then how many of those patients were readmitted to the hospital, that readmission rate, and then we do a comparison right here, which is against the state. So as we filter on the dashboard, as we click on certain parts to filter down onto it as well, the state rate will change, but it'll keep it at a state number as opposed to what's being filtered on. So it won't take into account like the zip codes or the hospitals, but it will take into account things like race or service lines. So we always use these to compare and say, if we're looking at Chicago zip code patients, they're a rate of 15%, but the state is slightly lower at 14%. From there, we have the charts then that build this actual dashboard. So because we are in the demographics one, every chart should refer to a patient demographic piece. Hopefully that makes some sense. So on the top left here, we're showing you the racial breakout. The gray bars are going to show you the number of readmissions that are occurring for that race. And then the dark dot is going to show you their rate. We're always looking at counts and rates just because population-wise, you might have a high population, so you'll have a lot of readmissions. But if your rate is low, that's what we want. So we're always wanting low rates from our patients. So you'll want to look at those in concert. So right off the bat, you could possibly see here that if we're looking at Chicagoland patients, regardless of what service they're coming in for, regardless of anything else about that patient, we can see that there is a decent disparity here racially between the Black and the white population in terms of their readmission rate. So as we kind of click through and filter on different things, I'm definitely keeping an eye on this. Down in the bottom left, we're looking at readmissions by age group. So again, same thing, gray bars here mean readmission counts, and the blue is the readmission rate. So as patients get older, they are returning to the hospital more, or they have a higher likelihood. And that kind of makes some sense, right? When we think about it, if you're an older patient, they recover slower, they're normally less healthy. We just kind of expect that in the hospital world. So this tends to make some sense, but we can definitely see some ebbs and flows here as we look at different services. Next to that, we have readmissions by ethnicity. So that's looking at Hispanics versus non-Hispanic population. And then up above that, we have it by gender. So you can see men, even though they are readmitted less in terms of sheer volume, they have a significantly higher readmission rate. I'm not exactly sure what that says about us guys, but I'll kind of keep that there. But definitely men coming back to the hospital more often within that 30-day window. To the right, then, we are showing you a heat map by the zip code for the patient. So the darker the color in the map means the higher the measurement. And we have a parameter here that lets users toggle between higher readmission counts and rates. Just like we do on our bar charts over here, we want to kind of always look at those in sequence. So right now, our map would say that if you live on the south side of the city, there's higher readmissions coming from that area. That also might mean, though, that there's a higher population down there. So if we look at the rates, this can now say, well, taking population out, really, where are our higher rates coming from? So if Chicago overall has a 15% readmission rate, some of these darker zip codes, they're hedging up towards 18, 19, even 20% for a readmission rate. So significantly higher than Chicago as a whole. And those would be the zip codes then we want to target and say, regardless of the patient, regardless of the service line, if we know a patient's coming from this area, there's a likelihood that they're going to have a higher readmission rate. So us as a hospital needs to identify, how do we get information across to them? How do we care for those patients better to make sure that anything from their hospitalization through their discharge planning, through their follow-up is understood and followed so that we can make sure that we keep the hospitalizations down for readmissions. So our dashboards are fully interactive, meaning if you click on any portion of this dashboard, it's going to filter just like it would if you set a filter up here within our filter show hide box. So let's start by just clicking on the male population. You can see the dashboard updates. And if we look at some of the different portions, you can see for our racial populations, the disparity there closed between whites and blacks. However, both rates rose. And that makes sense because men had overall a higher readmission rate. Men in the city have a 17, almost 18% readmission rate versus across the state, they're at 16. Conversely, if we wanted to look at the female population, we can now see that they have a lower readmission rate than men, but our disparity between our Black and white populations definitely grows. So white women have a readmission rate of 11% versus Black women have a readmission rate of 17%. So right off the bat here, we're not looking at services yet. We're not looking even at a certain hospital. We're just saying, generically speaking, if we're looking at women from Chicago, there is going to be a great racial disparity, and we can definitely start to then isolate which zip codes they're coming from. All right, I do see a question in the chat. Does the scale of the charts, race and age, align with the rate or the count? I think rate is just based on the view. Any reason for not showing the scales on the axis? Yeah, we don't have those just because we do show the actual numbers for the rates. So we felt that there was no scale needed, but that's definitely a good thought. So thank you. All right, so we can definitely do more here. So if we wanted to, add on a second filter, we could definitely do this. So if we wanted to drill further into our Black female population, we can start to see, well, what's happening with their age groups, where are they coming from, those patients, and then we can compare that against our white women population and see, is there a skew in our ages, or is there a skew in where those patients are coming from? So again, here, our goal is really to let the user dictate what they want to see, let the data dictate what they want to analyze as well. Because again, not every hospital is going to have the same outcome. If I start to look at DuPage County or Sangamon County, they're going to have drastically different dashboards showing up here in terms of where their data shows. So based on what the data is driving, I can say, okay, this stands out to me as a user at the hospital. This is what I need to drill down into. So really our goal with these is not to identify one singular patient. So if Jeff goes to a hospital and then is readmitted, well, what does that cause? We're looking again at commonalities between patients to say, if we know that there's a higher readmission rate for Black women from Chicago, let's start there. Let's figure out what that focus can be. Let's figure out what those hospitals that service these patients can do to bring down the number of readmissions so that the rates get lower and everything is a better outcome for our patients. All right, so I'm going to quickly switch over to a second example here. So that was looking more at a population-based view, but we can also do this at the hospital level. So I'm going to go into my filter and just choose one single hospital. Now it's going to be masked just because this is a demo, but if you ever end up using comp data, since you work for one of our hospitals, you'll be able to see hospital names there. But for now, you'll just see numbers. So we're going to choose one hospital. And again, you'd be able to see here what is the breakdown of their patients that are being readmitted. And you could start to analyze it a little bit further. Again, you can go into the map, see how cool that looks. But the fun part of where we're going with our new dashboards is being able to now say, if I've analyzed something here for my hospital and I want to learn more, I can toggle over to my next dashboard and the filters are going to carry over. So again, if I use my show hide box, you'll see hospital 56 is still being filtered on. And then here we start to analyze what will be the service lines for those patients that are being readmitted from hospital 56. So on the left-hand side, you're seeing their first visit. What did they come in for? So maybe it was a circulatory system issue. On the right-hand side, we can then see why are those patients being readmitted for visit number 2 within that 30-day window. So most of the time, those things are going to correlate, right? If you have heart failure, most likely you're going to come back to the hospital for heart failure, but there could be things like an infection, or right now COVID's raging. So maybe their readmission is coming in for COVID. Might not have anything really to do with the heart failure that caused their first visit, but if they're coming back to the hospital within that 30-day window, we can see that it would be a respiratory infection. We can even drill down into thinking of that sub-service line level, so we get really good details on this. So starting with a circulatory system case, they're coming back for heart failure or AMI, so on and so forth. I can scroll down here. And what that can let you do at the hospital level is say, if we're understanding what service lines have higher readmission rates, so looking here, this hospital has a 22% readmission rate, meaning 1 out of every 5 patients that come for a circulatory system visit end up coming back. That's not great. Then we can start to target and say, well, let's look at this service line first, as opposed to the hospital as a whole, and say, we're going to fix the circulatory rates first, bring those down, make them more comparable with the state rate or other hospitals. And that'll improve patient care and also improve reimbursements. The final thing I want to point out here within this one dashboard is we do then show where does that patient return to. So hospitals right now have internal data, right? You can go into your Epic system or Cerner and you can probably look up and say, well, I see this patient, they're coming back to us. Well, for this example, hospital 56, only 66% of their patients were being readmitted based on CMS guidance back to their hospital. meaning that hospital doesn't have that insight to the other third of their patients that are going to other hospitals within the state. So maybe they're going to the hospital down the street. Maybe they have a more severe case, so they have to go to a higher level care hospital. But either way, this hospital doesn't know that this third of patients had a return visit, which affects their patient outcomes, which affects their reimbursements. So these are things that those hospitals, those clinicians would want to know about their patients. So again, these dashboards have a lot of flexibility. There's a lot of things you can click into, filter on. We have other parameters here that let you change charts. So down in the bottom left, you'll see it showing by payer. You could change this to race to see the racial breakout of those patients. But we use a lot of different functions here in Tableau to help make our dashboards flexible because we do have so many different users that log into this and need to see slightly different versions of the same data set. All right, so hopefully I covered things fairly quickly and succinctly. I know I had 30 minutes, so I was trying to fly through some stuff, but I can pause here and see if anyone has any questions based on what you've seen and kind of how we're using Tableau at IHA. So if anyone does have questions, feel free to ask. Otherwise, if you do need to reach out to me, if you like our dashboards, if you just even want to talk Tableau and ask us how we did certain things, we're more than happy to answer those questions for you. So I'll throw out my contact information while people think of questions to throw into the chat.
Thanks, Jeff, for a great presentation. I think we do have a question from Kyle, and he put it on our chat box. Do you want me to read out? Or?
I can actually see those. Sorry, I was needing to look at the other screen. So Kyle's question, I think I answered going back to the readmissions demographics dashboard and just showing scale. Space is everything within a dashboard, so we try to maximize what you see within a chart, but obviously there could be good reasons to show scale so that you would understand how many this bar is besides just having to hover over it. I see a second question here. Could you please let me know if this is clarity sourced or caboodle? So this data comes from our member hospitals and they send it through a possibly slightly different process. We get either a flat file of the patient data from the hospital, which is in kind of a custom format, or hospitals send in the HL7 to us. But this is a process that happens every quarter for hospitals. So some hospitals send us data daily, some do it weekly, monthly, but every quarter we do a data update. So right now our data is through 2021 Q3, which would be through September of 2021. So it's a 90-day lag, but that's a rule that the state has set forth. So that's as quick as we can humanly get it out.
And a quick question, like, if anyone wants the access of your dashboard, is it available to access for anyone, or we need some subscription or anything? Yeah,
so the way people can get access to our system is you have to first work for a member hospital. So your hospital has to be located in Illinois. From there, I believe pretty much every hospital is a subscriber of comp data. And then all you have to do is fill out a form, which is on our website. So I can type that in here really quickly. But if you go to compdatainfo.com, this is our main website for our platform. And you can definitely set up a new user through here. Or if you want, you can send something to me and I'm more than happy to walk you through that process and talk to your primary user at your hospital who will give you access. But the only thing you have to do is be a member hospital in Illinois, which means you have to be based here.
That's really helpful. Good to know. So any Illinois hospital employee can have access to your dashboard.
Correct.
That's great. Thank you, Jeff.
Sure.
And Jeff, what about health centers?
Good question. So right now it's only, it has to be a hospital. Health departments, health centers, like a freestanding health center, they currently can't get access, but that might be an area for us to be able to move into. My viewpoint is the more data we can have, the better. So I'm always happy to explore that and talk about that. So if anyone does have questions about that, feel free to contact me, and happy to continue that conversation and see where that can go. But currently it's only Illinois hospitals.
Okay, because I know that my health department would just love this information. I love this dashboard, and it's so interesting. And I know, like, being from the data side of things, we get to see all of the interesting data, but we don't always get to see how the hospitals use it, or like before and after cases, if they actually like take your dashboard and then improve on things, which sometimes you can see on the back end, but
yeah,
it'd be interesting to see.
I agree. I see one other question here in the chat from Bart. How often does the data refresh? How long does the refresh take? So we get data once a quarter, or actually we publish data once per quarter. So every 3 months we add 1 quarter of data, and we actually trim off 1 quarter of data that's old. In terms of how long does the refresh take, I'm going to assume you mean how long does the extract run? But if you want to type into the chat to let me know that I'm understanding that correctly, I can definitely answer that. But because we have so many different types of dashboards, we have different extracts behind the scenes that drive them. So our readmissions one, it only takes a few minutes to run the actual extract. However, the process to get the data into the format that Tableau can use it is a little bit more complicated, because we are linking patient visits together. So it probably takes a few hours for our SQL server to run through the process to say, this is Jeff visit number 1, this is Jeff visit number 2, put it into the correct format so Tableau can then pull the data. But the actual extract itself only takes a few minutes because it's just inpatient data. When we're looking at some of our data sources that are looking at every single diagnosis code on every single patient record, so you're looking at 250 million diagnoses across the state, that takes, I don't know, an hour to 2. So in total, it maybe takes, I would say 8 to 10 hours for everything to refresh for all of our dashboards in our system. But that's a lot of other things that you didn't get to see today. So maybe I over-explained that one, but hopefully that helped, Bart. All right, I don't see any other questions in chat, but again, happy to entertain any either here, later, or offline with my contact information above. So thanks, guys, for letting me show you what we're doing at IHA, and we're happy to always talk Tableau with people. So whether that's me or Chandni here, she's also a Tableau whiz on all this stuff, and I definitely couldn't do half of these things without her. She's an awesome builder as well. So thank you, everyone.
Thank you, Jeff. That was a great presentation. I will grab the screen back. And if anyone has any further questions for Jeff, feel free to leave them in the chat there, and we may have some time later. But we're going to go to Sameera's presentation. And Sameera Narasinghe, which I might have butchered that pronunciation. Can you guys see my screen? No, I don't think so. There we go. Is a senior developer at Rush University Medical Center, and we're gonna take a look at his dashboard of employee vaccination compliance, and see not only the data side of it, but also organizational hierarchy security. So take it away.
Thanks, Kelly. Let me share my screen. Hi, everyone. So as Kelly introduced, my name is Sameera Narasinghe. So I'm working as a senior analyst at Rush University Medical Center. So hope everyone can see my screen.
Yep, looks good.
Okay, thanks, Kelly. So today I'm going to walk you all through the so one of the key dashboards which we have developed last year. So this is the main objective of this dashboard is to track the employee vaccination status. So this was like a very small project like last year. So we just started with the tracking the COVID vaccination status of the employees. And then this has been a big project now, and it's keep evolving very frequently. So we have added so much features into this dashboard. So so main objective of this today's session is I will explain what we have done in this dashboard, like on the Tableau side, and also how we have configured the security, user level security in this dashboard, and also how we have configured the automatic email notification to the end users. So those three will be the main objectives of today's session. Before moving to the actual dashboard, I will give a high level overview of the data architecture of this dashboard. So so we are using like four main data sources for this dashboard, namely, so the vaccination data everything is coming from Epic, and the employee data are coming from Info. We are using Info talent management to maintain the employee details at Rush, and we are using Accent to maintain the definitions. So any definition related to a metric, it's stored in Accent. This is related to any dashboard which are developing at the hospital. And also we are using Redcap to maintain the admin users for this dashboard. So we have two levels of user access to this dashboard. One is the admin. So admins are maintaining Redcap, as I mentioned earlier. And we have the end users, like it can be a CEO, it can be a manager. So all others are coming through the dataset in Info. So that's how we have configured the security. So I will go in detail into the security part later. So all these data are extracting daily into our data warehouse through the nightly jobs. And from the data warehouse, we are extracting this data to Tableau for the dashboard development. So this is the high level data architecture of this dashboard. Before I move into the actual dashboard, any questions? Hope I'm not too fast. Okay. Okay. So let me check. Okay. Okay. So I'll quickly move to the dashboard. So then we can answer the questions later. So so this the main dashboard has like 4 different tabs in the vaccination compliance dashboard. So we, as I mentioned earlier, we started with tracking the COVID vaccination status of the employees across the hospital, and then we have added the flu vaccination status as well. So both COVID and flu vaccination status are maintained in Epic at the moment, and then we are maintaining the status for both COVID and flu vaccination status together, whether it's compliant or not at the moment. And also we have recently started to track the booster shot as well, COVID booster shot status of the employees. So still it's not we are not taking into the compliance status, but we are tracking it in the dashboard. So in the main dashboard, we have the status and the details of the compliant and non-compliant the employees. So this is not the actual data set. This is like a sample data set which are using for this presentation. And in the second tab, we have the employee weekly testing details. So based on the testing details in Epic, so we have generated in this tab. And the third tab is the metric definition. So this tab is it's extracting the details from Action. So the details entered in Action, it's extracted into warehouse and it comes to here automatically through the daily job. So all these the definitions has a definition owner, and if it is updated today, so that will be automatically updated in the dashboard by tomorrow morning. And we have the non-compliant details tab separately. So we are using this tab to send the automatic notification to the managers. So daily, we are sending a daily email. So if there is any employee which is not compliant at the moment, that email will be sent to the relevant manager daily to take the necessary the actions. So this is the high level of the Tableau dashboard part. Any questions before I'm moving to the security configuration part? Okay, so I'll walk you through the security configuration part. So this dashboard actually it's a one dashboard for even you can be an administrator, you can be a manager, you can be end user. So this we are using only one dashboard for everyone to view the details. So the security has been configured to show the details based on the security configuration. Like if you're a department head, if you're a manager, you can view only your team details through this dashboard. It's a secured data set. So how we have done this is actually let me explain it on high level. Okay. So for our end use actually, so this will be the sample dashboard for a manager. So let's say like this manager has only 11 active employees at the moment. So he can view the status of the it can be either COVID, flu, or anything. The whole dashboard will be populated based on that manager. So once you log into the dashboard, you can view the only 11 employees across the dashboard. So he or she can view the status of these 11 employees in each and every tab in the dashboard. So how we have done this is actually this is starting from the SQL table. So the first table displaying here. So this is like it's equal to the SQL table. So in the SQL table, we have a row for each employee, and against each employee, we are maintaining a string. So this is in a one cell in the SQL table. So in that cell, we are maintaining the Active Directory user IDs of every user who can view this employee in this dashboard. So first of all, it can be starting with this direct manager, and then the first step, one up manager, two up manager. So likewise, it will go up to the CEO actually. So if you have defined the hierarchy properly in info, so this employee can be viewed throughout this hierarchy. So we have bring that hierarchy from info and convert it into the string in the SQL table. So this is this has to be done for each and every row in the data set. Otherwise, this security configuration it will not work. So it should not have any null values. It should have definitely there should be a record for each employee in this use ID column. So then, so this is the SQL part. So what you have done doing the SQL, and then so we are using. So the next part is configuration in the Tableau. So in Tableau, you have to use the readGSP underscore match function. So this is like an inbuilt function. So through this function, we are so this username is the so Tableau can pass the any logged in users Active Directory user ID through this parameter. So this is like a inbuilt parameter comes with Tableau. So we are using this parameter to check who has logged into the dashboard, and then we are exactly matching that record with the user ID field, which is coming from the SQL. So let's say, so the third one is the example. So this, let's say the user is a chart DNA white. So this is a user. So if this logs into the dashboard, you can see in the first table, there are 3 rows with this user ID. So in the report, this user can view only these 3 rows once he logged into the dashboard. So that is, in the simple terms, that's how this works. Apart from this regexp match function, you can use the contain function as well. But so there's a small issue with the contain function. So let's say if you have 2 user IDs like ABC and ABC123. So if you use contains, it's working as a like function. So if you have ABC and ABC123 2 usernames, that will be, so both employees can view the whole data set actually, because it's using it's working as the like function in SQL. So best function to use for the security is the regexp match. So this is exactly matching the user IDs in your string with the logged in user's user ID. So that's how this whole the security configuration works on high level. Any questions? Okay. So let me go back to the dashboard. Okay, so as I mentioned earlier, we have the third tab. So this is third tab is the tab which you are using to send the emails to the manager. So for the email confidentiality, we are using the subscribe option. So this is available with the Tableau with any Tableau version. So subscribe version, it's mainly actually, so there are 2 ways actually. One is the Tableau administrator or the developer can configure the email subscription on behalf of the employees. Also, the users can subscribe for this report by themselves, and they can unsubscribe from the dashboard emails as well. So when you're subscribing, you can use the either you can subscribe it by individual users, so you can subscribe by its based on the security groups in Tableau, and we can subscribe for the current view or for the entire workbook, and we can subscribe for the image, PDF, or both options. Actually, in the previous versions, we had only the image option. We didn't have this option to select. So with the latest versions, we have the all these options as a drop down to select. So this will be the email subject, and then you can put a custom message. So please keep in note that the custom message will be displayed at the very bottom of that email which you're sending to the user. So there's a high chance the employee or the user will not see this message. So that's the reason for putting this the red color text at the top of the dashboard, because that will be the first thing the users will be seeing for troubleshooting or for any queries. And you can set the frequency of the emails, and yeah, that's it. Simply, actually, you can configure the emails like this, very straightforward option. But the tricky part of this is actually our requirement is like, because we are sending the emails daily for all the managers, and we didn't want to send the emails for the managers. Like if there is no employee with non-compliant status, we didn't want to send the email to the manager. So simply like if there is any, if manager logs into the dashboard, if this is blank, we don't need to send the blank email to the manager. So we could have done that thing with the first page as well, but so this will, each of these panels in the dashboard, which will have a value at any given point, even though that manager has like a zero non-compliant employees, because we are displaying the non-compliant, compliant, all the status here. So if we use this dash tab to send the emails, this will send the email to the manager every day, because this is not this will not be blank. So it will contain a data. So Tableau will check the dashboard that it's contain a data for the manager, and then it will start sending the emails, which is not be wanted. So that's why we have separated these non-compliant details into a separate tab. So so every day Tableau is checking the this tab and sending the email to each and every manager. And if there is a manager with 0 records in this tab, it will skip that email. So it will Tableau will not send that email to the manager. And the beauty of this the option is like Tableau is checking that the security configuration which we have configured here. So this configuration is checking before sending the email. So Tableau is checking how many employees are non-compliant for this manager, taking the details and sending the email. So that's how it works. So it's not sending the full data set for the each and every manager. So that's how the automatic email configuration works. Any questions on this one?
I have a question just to, because I'm actually working on a report that I want to distribute to physicians that just contains their own specific data for their patients. But so the configuration you have set up, it does that for managers for flu and COVID data.
Yes. So as I mentioned earlier, so we are sending this data is related to the employees. So we are maintaining the record for COVID, flu, and booster shot details for relevant for employees. So this the hierarchy for this the security configuration is coming from the info, because that's where we are maintaining the reporting hierarchy of the employees at the moment. Did I answer to your question?
I think so. So how do you pass it to Tableau?
So before we start passing it to Tableau, actually we have to build that data. We have to build that data set in SQL level. So this is like you can see my screen, right?
Mm-hmm.
Yeah. So this in this slide, the first table it's equal to the SQL table. Yeah. Let me take the this is actual SQL table.
Mm-hmm.
So for each,
is there a variable, like is for the subscription, you can pass a variable in the subscription so that to return specific results? Is that?
No. So subscription actually, so subscription will use. So in the subscription, actually, you can't separately configure any security. So subscription will use the security which you have already configured in the dashboard. So let's say, like in your case, like if you want to send the patient details for each physician related to their area, that's your recomer, right?
Yeah.
Okay. So in that case, what you have to do is, so let's say this as an example. So this, let's say this is actually the MRN or the patient ID for each patient. So against each patient ID or the MRN, you have to generate a string with the active directory of each physician. So let's say this patient can be visible by 2 physicians. You have to have the active directory user ID of those physicians in this cell, in a separate cell actually. So this has to be done in the SQL level. Then once you go to the Tableau, you have to create a calculator field. Like this can be like, you can give your own name. I just use it like user filter, and then you have to use this function that GXP match. And this username, like blue color username field, is the logged in user ID, is logged in users active directory ID that is already passing by the Tableau. So we are using that parameter, and we are matching it with the user ID field in the SQL table. So in your case, what will happen is, like, let's say the username will be the logged in physician's Active Directory ID. So you are getting that ID from here. And when you are preparing your data set, if you had that the username string in the data set, it will check whether this physician name, physician's user ID, it's available in any of these rows. And then if it is available, it will display those rows to that logged in physician. That's how it works.
Okay, I think that answers my question. I'm just curious about the actual, so there's a calculated field and then you just filter on the field, and then how is it, where do you pass the variable for who is receiving the subscription?
Okay, so so once we configure this this configuration, I can't see your name. Could you please?
Emmett.
Sorry?
Emmett.
Okay, so Emmett, so what will happen is, like, once you configure this security, and once you try to configure the subscriptions, the subscription will automatically use that configuration which you have already done in the dashboard for the subscription as well. So you don't need to do anything special for the subscriptions. It will use the security which you have already built into the dashboard by the Tableau server.
Okay. So it's the filter is activated based on the security of the users who are what data they're allowed to access.
Yes. So let's say one example as the physician A. So so you had to first build the dashboard. Like, once the physician A logs into the dashboard, the physician A should view only the patient he can under his profile. And then if you configure any subscription for this dashboard, and once the Tableau server sending the emails to that physician, it will first check the security configuration you have done the dashboard, and based on that only it will send the details to the physician. It will contain the patients relevant to that physician only.
Okay, I think that makes. I think I got it. Thank you.
Sure. I'll share my email address. Like, if you have any questions, let me know in the configurations.
Okay, great. Thanks.
Sure. So that was a good question. Any other questions?
This is Chandni. So I was gonna say the subscription's based on the user subscribing themselves, or is it you subscribing for them?
So in our practice, actually, we are subscribing the emails by the admin, not by the end users. So so we are using mainly two methods actually. One is we are creating a custom secret group in Tableau based on our existing AD group or based on the custom user list, and we are using that group to create the subscription. We are not creating one by one because it's like a long list. So
Right.
mainly we are using the custom group and using that custom group to create the subscription in the dashboard, and that will be done by the admin because that's the other thing actually. Like, so if this subscription configured by the developer, when you're sending the email, at the end of the email it will mention the developer's name. So to avoid that, what we're doing is actually we are configuring the subscription by the administrator, by the Tableau administrator, to avoid that like miscommunication at the end of the email. Otherwise, like employees are trying to send the emails to that the name at the
Right.
Hope I answered your question.
Yeah.
Okay.
It looks like there's another question in the chat, and it says, it's from Bart, and it says the top right corner with the refresh date 1/17/2022, is that value from the extract?
Yes, so that date is coming from the extract. So this whole data set, it's come to we are bringing to one table in SQL, a final table. So in that final table, we are maintaining the refresh date of the data set, and that's coming to this dashboard. Actually, it's coming from the the main data source of this dashboard. This refresh is not the Tableau refresh date. This is coming from the data source refresh date actually. When we refresh the Epic data set actually. Thanks, Bart. So I'll put my contact details in the chat. So if anyone has any questions or any questions on this security configuration, please let me know. I'll try my best to help. So, so that's all about the vaccine compliance dashboard which you built for Rush. Over to you, Kelly. Thank you so much, everyone.
Great. Thank you so much, Sameera. That's a very interesting dashboard. And do you happen at Rush to have any other use cases for your security configuration?
Yes. So most of the HR related dashboard we are using this configuration. So mainly it can be the performance evaluations of the employees. So we are using this dashboard for this for that performance evaluations, because managers can give the evaluation details of the relevant employees. And the other use case scenario is like the merit awards. So when we are releasing the merit awards for the employees, so we are using the same security configuration. So the managers can open the merit report of the relevant employees, print it, and give it to the users. Not they can't view all the merit awards through the report. So there are so many use cases which are using this mechanism. So it's like this configuration is like a one-time configuration which you can use it as like a which you can reuse actually for any dashboard. It's a one-time thing, one-time configuration. The SQL preparation is the hardest part. So if we can prepare that thing, so everything else will be easy.
Did it take a while to configure the SQL, or did
Yes.
some of yes, okay.
Yes.
It looked a little convoluted, but I wasn't sure if any of your data architecture already had something like that would like some of that data in it that would help you build that, or if it had to be done from scratch.
So if anyone is using the info talent management application, I can guide how to do that as well actually to build this thing because it will be the same replication someone has to do.
Okay, great.
Yeah, this is in a Rush, like this is one of our breakthrough concept of having this configuration with the users. So we are using in a couple of dashboards, and all high-level managers love this concept. And yeah, it is one of the successful story to tell. Thank you, Sameera.
It looks awesome. I was
Thank you,
going to say
Imran.
there can probably be multiple HR use cases, right, with like performance reviews and things like that. That configuration can be used for too.
Yeah, that's correct, Chandra. Actually, so we are maintaining one table for the against each and every employee number, like what is the configuration. So that table can be reused for any dashboard. Actually, that's the beauty of this configuration.
All right, I'll go ahead and steal this screen back. Well, those are some great presentations. And like I said, if you have any other questions, you could feel free that pop up now. Feel free to add them in the chat, or we'll definitely post this afterwards. So you can always add them to our Chicago Healthcare Tableau user group page and they'll get answered. So, and then for our final topic for today, we did a few of our leadership group's favorite conference highlights, which is we have more than just a few. It was tough to narrow them down, But feel free to add in the chat your conference favorites as well, or any tidbits you want to share. So first, we had a lot of people agree on this, the Tableau Zen Masters sharing their best advice. Just a lot of fun tidbits that we enjoy. Devs on Stage, which I think was one of Chandani's favorites this year. From Soup to Nuts, how data is turned into insights. And then Unleashing the Power of Healthcare Data, which is topically relevant to our user group here. Making dashboards engaging, informative, and accessible is one that a few members of our group really like too. And I don't know about your workplaces, but I know mine seems to have a format and get in a little bit of a rut in our dashboard. So it's always good seeing some fun tidbits or tricks and just helpful little things, and especially what's new about Tableau that makes things easier and better for our end users. So that's always a good one. And then another one, yes, you can have data governance and self-serve analytics all together in one. And then some honorable mentions. One of our favorites, I think Heather listed this one, was the keynote is always a big favorite. And I don't know about you guys, but I always find it exciting and kind of very motivating. It makes me want to like get in Tableau and see all the new features and just kind of expand what I'm doing on an everyday basis to see if I can add something new. And then another good one to check out if you haven't already is the healthcare and life sciences track. There's a couple good videos on there that are always really interesting. And I feel like it's along the lines of this user group, how it just, I think it's the most helpful for me to see what other healthcare groups are doing, especially similar data to what we do in our work every day, but see how people take that similar data and use it differently and display it differently. So that's always helpful. Were there any other favorites?
Are they still available on the conference on a YouTube, right? So we can search.
Yes, they are. And I will post the links to our favorites along with the link of this video after today's meeting. So you guys don't have to go search for them. You can just click the links and they'll take you right to Tableau.
Cool. Thank you, Kelly.
Yeah, no problem. And then
yeah, another one of my favorites was it's called Bland to Bold Dashboarding Tips. So I was thinking the same as you, Kelly, where we have a lot of like standardization with the dashboards, but like trying to think outside of the box, it can always be fun to play around with dashboards and stuff. So that Bland to Bold Dashboarding Tips session was also one that was fun to listen to.
good one. I'll add that to the list. Did anybody else have any favorites? And you can raise your hand if you want to be unmuted or add them into the chat or. If not, that's cool too. And then I think we're ready to wrap up. I want to say thank you for joining us today. Like always, we'll post our the meeting afterwards on YouTube, and it'll be on our Chicago Healthcare Tableau user group page. And then, like always, if you want to see any certain topics for presentations, let us know. We can help facilitate that and find the people who are the experts in the fields. And we want to know what our user group wants to see. Also, if we love having presentations from people in our user group, like Jeff and Sameera just had great presentations, and we'd like to hear from more of you about what your work is doing, or even if you have any Tableau questions, we could get a Tableau expert in here to do some demonstrations or whatever you guys want to see. And then, so I think we'll see you next quarter, and I think we're gonna add some interactive elements in and maybe have a fun Tableau giveaway. So make sure to check back next quarter and invite your friends.
Yeah, and if you have a dashboard you're working on and you want everyone to just kind of see it, and you want maybe like some feedback, or you just want to, you know, just show it off a little bit or something, definitely let us know, and we'd love to put you on the presentation list.
Yes, absolutely. Thank you, everyone. And thank you especially to Jeff and Sameera. Great job.